Hi there, and welcome back to our next webinar, which is all about social impact and value measurement. My name's Nicola. I'm one of the founding directors of Flourish Together. We support various social enterprises, charities, projects, campaigns that are all about creating social change. And we're really pleased that Sector 3 has asked us to come back and do a series of webinars, this time as part of the Proper Good project. And there are a series of webinars that we developed for their Inspire to Enterprise programme, which might also be of interest. And we'll put details of those in the YouTube notes so that you can have a look at those along with the other two webinars that we've done. So we've done a session on business planning and the business model canvas. We've done a session on income generation strategies. And we're following it up with social impact and value measurement. And we'll cover a little bit of theory of change principles in this as well, because you can't really look at social impact and value measurement without that. So you'll see what we mean as we go on. So I hope this is of interest. So whenever I look at impact and value measurement, I think there's three key questions. Whether you're starting out, you've been doing this for some time, or you're scaling up, what is social value? Who cares and why bother? It seems like another job. It's often something that people sort of think about some way down the line. And wherever possible, we try to help people at the earliest stage think about simple methods to get started or improve what they're doing. And, we're going to try and look today at, what it looks like when it's done well, and really take the mystique out of this stuff with a bit of luck and show you that it is possible and there's ways that you can start to use this as a way to evidence and build your reputation and strengthen bids and all sorts of other stuff. So what is it? Basically, social value is the relative importance of change that occurs to a stakeholder's journey as a result of an activity. That's what the SROI network, Social Return Investment Network, said back in 2013. And it's still the case, really, that trying to understand in terms of your stakeholders, so that means your customers, your beneficiaries, and any wider interested parties in your work, what's the relative importance of the change that occurs to these people? What are they going to value about what you do is ultimately, and what's the value of the change that happens? This, social value is produced over a period of time, and that the stakeholders engage in whatever it is you're doing. Some of them are directly involved and some of them are indirectly involved, as we'll come to see shortly. But, we measure social value from the start to the end of somebody's journey with your organisation, with their beneficiaries or otherwise, direct beneficiaries or otherwise. And during this journey or during this time that they link to you, work with you, benefit from your projects, activities, goods, services, we're trying to understand what's changed, as a result of their engagement with you and what you've done with them, how you've supported them, options that and opportunities that you've helped open doors for and create for them. And we're trying to figure out what has changed as a result of that journey, that interaction, that intervention, that activity, that program, whatever you call what you do. How does it change people's lives, basically? How does it improve things for the better for individuals, perhaps for the environment, for a whole range of other things? And this is known as the theory of change. If you understand and or you can preempt, plan, or have ideas for what's going to change in people's lives as a result of your intervention or activities, that's your theory of change. And that's something we're going to look at in just a second. So the other reason we look at this, is to help try and capture and calculate what the value is and add up and account for the social value that's happening. Social accounting is the method, that's used to measure this change that we talked about. So we're measuring the change, measuring the impact and the change that's happened. We're recording and gaining evidence of this change. And then we're going to try and report and communicate what this might be to a variety of different audiences. So I'm going to show you over the course of this webinar how other people do that and give you some tips and prompts as to questions and things that you can get started with now with your direct beneficiaries and indirect beneficiaries to start to measure what's happening and how people are valuing what you're doing. And it's useful for lots of reasons. It helps you sleep at night to know you're doing a good job. It helps you show whether or not you set out what you achieve to do, both in terms of activities and outcomes and so on, but also in terms of the impact you're trying to create and whether there's value that can be put on that impact. And it helps you communicate, as it says here, with a variety of different audiences. So some of this information you might use for testimonials and for case studies. Some of it you might use in your funding bids. Some of it you might use in other ways, as we'll come to explore. There's currently, over 1,150 impact metrics. These are sort of measurement metrics, sort of ways to say changes happen for people. And these different methods and metrics are being used around the world. Some of these metrics look at things like, carbon emissions. Some of them look at jobs created. There's something called the happiness index. There's all sorts of impact measurement methods, and often these social accounts, some sort of the report that gets produced, it's a summary of the change that's happened, be that impact, be that value added to society or to savings from the public purse, if you get that far. These might also be called, sustainability reports, CSR reports, environmental reports. This stuff might be tucked in someone's annual report. Particularly if you were a community interest company, you'll be asked for your KIC report to put a company's house up via the KIC regulator each year, where you've got to report back on your statement of community benefit and say what you've achieved. This is all part of community organisation sort of impact measurement and the social accounting tapestry of reports that can be put together. Call them what you like. They're variations on a theme, but a social impact and value report will really go quite thoroughly into this, as opposed to just summarise sort of headlines within another report. Anyway, let's continue. So why should we do this? I've alluded to a little bit just then, but if we look at sort of nationally and historically, I guess, something called the Public Service Social Value Act came into place in 2012. People were sort of banging on about this well before then, and lots of people were measuring their impact and value before then, but it became a little bit more of a priority and of interest to the public sector, because an act was brought into play to try and give better opportunities and more of a focus and a priority to creating social value. Various EU funds, some of which are coming to an end in the UK, but there'll be partnerships and collaborations around this. European Commission legislation has written certain benefits into, or certain priorities, should I say, into the legislation. And if you're applying for EU funds, individually as part of a partnership, they'll be wanting to know what you're doing in terms of social value, how you're measuring your impact. They've got policies they want to see around all sorts of things that all relate to social impact and social value. Social impact investment, so as part of the Proper Good Fund, there's obviously different grants and loan investment options, and in order to go for that and other social impact investment options, they're wanting to see what outputs and outcomes and impact and value you're going to bring as a result. People want to know if they're investing in organisations that there's a social return as well as an economic and financial return. There's been the growth of ethical consumerism, over the sort of 80s and 90s into the 2000s, and then certainly more recently, talk of climate change, achieving net zero, the rise of sort of veganism and all these sorts of things have changed the way people, reduce, reuse, recycle. Everybody's a lot more aware of the need for sort of environmental as well as ethical consumerism in terms of creating a ripple effect from where you choose to purchase what you're doing, and not buying things and investing in things that are going to cause harm to others in this country or around the world as part of globalisation. Some of you might have heard of the term corporate social responsibility. So lots of corporates, large multinationals and corporate banks and global organisations recognise that there's a social responsibility, both in terms of people and planet, and they want to be seen to be doing good, either, because it's part of their core ethics and values, or because it looks good. They vary in terms of sort of motivation, but social responsibilities become a bigger thing, and there's all sorts of things like the SDGs, Sustainable Development Goals, and different ways that people are now reporting, ERGs and various other terms that get used in the private sector around accounting for sort of environmental and social goals and responsibilities. And there's people often wanting to create some sort of social contract or pledges or commitments or charters for how people will do better, be more ethical, do good, invest in communities. And we've talked before on our business planning and business model canvas, but we talked about the social value proposition as part of your wider business planning strategy. And this ties in with lots of different people's business objectives these days. Really, it creates a useful evidence of both where you can calculate that financial savings or benefit that you're creating. So how you're saving the public purse, how you're not only addressing societal challenges, but because of the way you work, what you're doing, who you choose to buy from, who you choose to recruit, it's saving the public purse. We'll come back to what that means. Building different kinds of trust, track records. It's a case to stand out and compete. Lots of other private businesses, let alone voluntary community sector organisations, are tracking and measuring their social and environmental impact now more than ever before. And even as emerging social ventures or growing social ventures, or even if you've just got ideas for running a project, understanding what you're setting out to achieve, the social impact and the change that you're hoping to create as a result, then being able to measure that and get feedback on what happened and what's changed as a result stands you in much better stead for looking at repeat opportunities, contracts, funds further down the line, because you'll be able to justify and evidence why an investor, a funder, or anyone else should back you over and above anyone else. It definitely makes your reporting more meaningful. As I've said, it's useful for marketing and testimonials on your website, content and information on your marketing materials. You can use this information to strengthen pitches in your case for stuff, as we just said. And as I said earlier, most social entrepreneurs going into this because they genuinely want to see the difference. They don't want to lead the change that they feel is needed, and knowing that you're doing that and having it, all the I's dotted and the T's crossed to show that that's happening, definitely helps you sleep at night, if not motivate you for the next day on the roller coaster that is running a social enterprise. In an earlier webinar, I did mention as well, I think it was in relation to commissioning, that Nesta have produced good practice standards, and this is a useful document that if you want to try and understand different levels or stepping stones to starting out in or improving your evidence gathering and impact measurement, Nesta, as I say, have improved this guide, and it's got about 5 levels, and there are some commissioners and some funders now that are have these expectations around what you should be evidence gathering, and starting from very basic stuff right through to full on high quality social impact and value reports, and everything in between. And that could give you a flavour of that by having a look on their website at their standards of evidence. Something to have a think about. So before we get into social value and impact measurement and how to communicate that, taking a bit of a step back, and I'm suggesting, if you haven't done already, building on or working in tandem with your business model canvas, planning your theory of change is a really helpful thing to do. The business model canvas structures things in such a way that you can see the different jigsaw puzzle pieces to how your sort of business elements will fit together, from what activities and services you're going to run, how you're going to resource those, what the impact is going to be, what the social value proposition is going to be as a result, and how you're going to market and do your market intelligence gathering and research to support all of this, how you're going to champion and build sales channels as a result. And it helps you look at, costings and what you do with surpluses and everything else. So that's one tool to use in planning and thinking through your, the business model, if you will, of what you're doing. But the theory of change helps you refine what your products and services are going to be. It helps you really strengthen what your social value proposition is going to look like, and it gives you a sense of what you might need to measure, or who you might need to talk to check that you're having an impact. So this little tool here helps you build and go a bit deeper into some of those areas of the business model canvas and just frame things in a slightly different way. So we talked about mission, previously, and I think I gave a couple of examples of an 8-word mission statement. If you can do that, lots of people have big, long, wordy stuff. From Flourish's point of view, our vision is a world where, women are able to support people in their communities, lead social change, and increase their economic independence, because we know that women make good entrepreneurs, leaders, and innovators when they're given the chance. So our vision is a world where more women are actively involved in leading change they see needed in communities. So the vision can be a little bit more wordy. It's the big picture of why you're doing this. Your mission is a kind of very succinct statement as to what you're doing in order to achieve that. So our mission is, we support, we invest in women as a force for social change, and we support them to increase their economic independence. In a nutshell, that's what we're seeking to do. We reinvest our surpluses in supporting women as a force for social change, and helping them increase their economic independence is what we're all about. And then, there's various ways as to how we get there. And I've got a case study example in a second, but if you've not thought through your vision and mission yet, this is a chance for you to think about that. If you could answer the question, our vision is a world, a community, a sector, it depends what you're seeking to achieve, but your vision is a world where such and such happens, such and such is different, is improved. What's that vision? Where can you see a world looking better if you achieve what you set out to achieve? What will it look like? What is that vision? And have a think about, how you might phrase that. The mission is pinning it down to sort of an 8-word summary as to what you do in order to achieve your vision. And then building on from that, we then start to look at how we're going to get there. So there's thinking about, and again, this is just a kind of reframed version of the business model canvas, but it helps you describe things in a theory of change, so that if someone's asking you, what's your theory of change, you've got an answer that flows. So, our vision is a world where, we do this by, your mission, and then how will we get there? You've got various, solutions, services, interventions, activities that you run as a result. The partners and people you have involved or that you need are X, Y, and Z. This then achieves, whatever you're seeking for it to achieve, and the impact of that, we'll come to look at an example in a minute. Sometimes you need to sort of focus in on what the strategic priorities are for you to achieve your vision and your mission. And so there's some space there to think about that, because those strategic objectives might help you focus how you operate, might help you focus who you partner with, might help you focus where you apply for funding, as we'll come to see in a sec. And ultimately, just to recap and connect it back to your vision, we're doing this because, so there's a reminder, this is almost like a pitch document in a way of, our vision is a world where such and such happens. In order to achieve this, we're whatever it is, how we're going to get there, you've got various elements to think about in order to how you're going to get there. And then you're just refreshing people around what your key strategic goals and objectives are and why you're doing it. And in theory, if you pardon the pun, that's your theory of change. There's different tools and ways of doing this, and this is quite a simplistic one, but we've done it on purpose to not, make this too complicated. I've got a document, a filled-in version of this I'm going to show you now, which is a bit of an eyesore because there's a lot of writing, but hopefully I've given you a quick flavour of what Flourish is about, but I'm just going to show you about this organisation. It's an organisation that I work with in the Midlands. Still going strong now. And, their vision is a world where parents, families and people from all communities are equipped and supported to manage their own physical and mental health, as well as able to support others using self-management techniques. So that's their vision. And yeah, there's always room for tweaks and room for improvements, but that's where we got to when this document was put together. Their mission was to be the UK's leading self-management care provider. That's what they felt their mission was, to be the UK's leading self-management care provider. And again, it goes back to that eight word mission statement. I mentioned it in the Business Model Canvas webinar at the start, that Stanford University did a review around social innovation, looking at work of non-profits, and the recommendation was this 8-word mission statement, and I'm just checking that sort of ties in more or less with that. So they then start to think about how they're going to achieve this vision, and how they're going to become this leading, self-management care provider. So they're going to deliver their own these Hope self-management courses on and offline. They're going to develop peer learning programs and build the capacity of, a local trainers network to sustain support. So build champions and train the trainer in order to make sure that other people can cascade this training and learning. They're going to develop this network of thematic champions to raise awareness and promote the impact of their work. They're going to deliver bespoke programs to aid development of their cutting-edge research into self-management care. So this was actually a spin out of a university as well. So they were both delivering these programs online and offline, the peer support and networks, and they were researching the impact of that, so they could, provide this sort of cutting-edge research into it as well. The partners that they needed and actually had on board at the time, so that the Autism Society and groups, the MS Society, Macmillan, cancer support, were groups that they were already working with, and they were having conversations with HIV and AIDS support groups. They got this model for ways of working with people affected by life experience in different ways, often health-related life experience, and they'd found self-care and self-management tools and techniques to really bring people along, so that they didn't need to rely on GPs and mental health support services, physical support services, medications and other things. That was the goal. And obviously, alongside those partners that they needed, almost as customers and beneficiaries, commissioners of work, they also had, the University of Coventry, as a key ally in what they were doing, and future commissioners they were hoping were people like NHS England, CCGs at the time, GPs and others, to buy into what they were doing and help scale it up in other areas. So they were thinking about the short term and the long term there. As you'll see here, and when you do this yourself, there'll be bits you don't know. There'll be a bit like the Business Model Canvas. If you looked at that webinar, you look at it and you can only fill in what you know. And then what you don't know is absolutely fine, because you can work with somebody at Sector 3, somebody at Flourish, or some other advisor or supporter to help you fill the gaps, work out the rest. So here they knew, in terms of the results, how would they know if this has been a success, or how would they measure to find that out? They thought they needed to know the number of people per year that would be undertaking the programs and courses. They thought they'd need to measure the number of trainers that they were going to skill up each year, and that would be supported, of those trainers, how many were also continuing to be supported through a learning hub. They capture and calculate, tally up the number of activities that they're undertaking each year as an organisation, what was happening through their partner organisations, and how many new groups have been involved, new people each year, and then be looking at the self-care programs across these different sectors just to see what was happening and getting various kinds of qualitative and quantitative information about that. In terms of how they'd know if this has been a success, tallying up the numbers, asking people how they benefited from what was going on and working out have they had an impact. They're anticipating people will be living happier, healthier lives and living more independently for longer. They imagine that they'll be if that they know that they're reducing the medication usage for people involved in the self-care and self-management groups. That people might be experiencing less frustration or less ill health, or be able to manage chronic conditions better. There'll be less GP and hospital visits, and they'll have strong communities, and communities of experience who can provide effective support to one another and be empowered to manage their own needs. So that's what they envisage their impact is going to be, and putting in some quite powerful sort of statements that they can then, in asking the right questions and analysing things in the right way, they can see if this is actually happening. For them, their strategic objectives, that they were looking at was, they were going to design and deliver high quality hope self-management and peer support programs across a broad range of sectors. So one strategic objective is to reach a broad range of sectors and be cross sectors. Another strategic objective was to train and develop others, and that would then ensure quality and consistency, and that they would believe that they would do this via a license, which would help them keep a level of control over the quality and the content, but also potentially, depending on whether people have to pay for that license, create an income coming through as well. And they're saying that they're going to build a needs-led culture of continuous improvement through shared knowledge and research. So strategic objectives is, they're not just opting for one sector or area, they're wanting a broad range of sectors they're going to work with. They're going to train and develop others, and so that they've got the capacity to build people and teams in different areas to deliver what they're doing, and that they're going to build a culture of continuous improvement through an online, so building an online knowledge sharing platform and a way of evaluating and improving what they're doing is going to be key. And just bringing it back to why they do it, we believe and can evidence that self-management and strong support networks are the most effective tool to help people live happy, healthy lives. So that's the way they approach their theory of change. Yours will look completely different, but at least seeing rather than a blank document, seeing an example that's being completed might just give you the impetus to start having a look at that. So I'd really recommend, hitting pause, taking a step back and having a look at this and starting to put down some of your own thoughts, filling in the bits that you already know and starting to bullet point and piece together those other sections as well. And you can always flip backwards and forwards, to think about, well, how did somebody else do this, or what else? And there are other examples online. People do publish their theory of change as a way of showing their communities that they've thought things through and that they've set out their stall. And so you'll be able to look at other people's theory of change, perhaps a similar organisation to yourself, working in another area or nationally, to help think through your own circumstances. So now we've looked at theory of change, we can build on that. As you'll see from that theory of change here, once you've got your theory of change down and you think what the results are going to be that you might need to measure and what you predict or project that impact to be, that starts to help you move along to capturing and measuring impact and having a sense of what you need to do. So, it's worth having a think now. Where are you at on your journey to doing this? How is social value being, captured in your organisation now? What methods and tools have you been using, if any? If you're brand new, you won't have anything in place. Even if you've been running a year or so, this might have been off of your radar, or some other job that you had not focused on just yet. But if you have been looking at this, or you've been thinking about it, or maybe you've got, what often happens is people are capturing things, but they're not doing it in a coherent way, and they're not doing it in a way that's comparable and that's consistent, and that can then be analysed and turned into data or information or reports. But have a think what you're up to right now. Is there anything that you're doing currently, and just, you're going to build on what you started, basically, and what methods, what have you got the capacity to do you think, in terms of measuring this stuff, and who else might you need to involve? Is something we'll think about, and what it looks like when it's done well. I'll give you some examples. But just thinking, where are you at in doing this is quite key to knowing what you're going to build on. So you might have seen some of this language before, and it's been used across these webinars and other things you've done, but we know now, a theory of change, is one part of the equation. And, it's about the changes that are expected or that you anticipate for your beneficiaries, your service users, people in your community, and it's as a result of your activities. We just talked about all of that. We know that, there's areas around arts and culture, there's well-being, there's education and skills. There's lots of different ways that you might be creating impact, and we'll come back to that. But what we want to do is move you on from thinking about, inputs. Well, we're going to look at what this all means first of all, because it's, jargon at the end of the day. But ultimately, there are inputs that happen. That's your time, your resources, what it takes to get to the point where you can deliver your activities are your inputs. Your activities are your key services, your activities, your interventions, your programs, and what you physically do. And then there's outputs, outcomes, impact, and value. And I've got a task we're going to walk through in a minute. But basically, if you can navigate your way through this, it will give you a really clear sort of direction of travel from your theory of change into how you measure your impact and value. And we're going to walk through that in a second. So clear as mud, but bear with me. So what I just talked about a minute ago was outputs, outcomes, impact, and value. And that's what we're just going to walk through now. What does this actually mean? And how could you put it into your own context? So an output is what has happened as a result of that stakeholder's journey. So you've thought about your theory of change. The output is what happened for that person as a result of getting involved with your stuff. So in this case, it was a course, and in this case, Jenny, name whoever you like. Think of somebody who's going to or who has attended a service or an activity or whatever you've been doing. What's happened as a result of them turning up. Yeah, your output is Jenny turned up. She's attended our course. So that's tick number one. That's the numbers of people who turn up. And then that's often where people start. Oh, we had 25 people came on our course. And over the course of a year, we engaged with 100 people who came to such and such a thing. And that's fine. But you'll see, it only tells you so much. If you're only counting the numbers of people that turn up and you're not thinking about, their background, their demographics, why they may or may not be in more need of what you've got, that's one impact measurement area lost. And then there's all of this other stuff, outcomes, impact, and value, that as you roll on, people, it gets less and less captured depending on what people have thought to do or the questions they've thought to ask. So Jenny's turned up to this course, that's your output. Your outcome is what change has happened as a result. So this is that theory of change bit. What happened as a result of Jenny attending the course? Jenny's improved her confidence. Good. So it was a confidence building course. She has improved her confidence. And she might have achieved other things. She might have, she might have upskilled in a particular area. She might have, built her confidence to try new things or started to access new opportunities. There's a whole range, whatever she's doing differently now as a result starts to sort of overlap between this outcome and impact. So the outcome, she's improved her confidence, or she might have built the skills, or she might have done something else. That's, think about your own circumstances. As a result of building that confidence, what else has happened? What's happened next? So, or as a consequence of building her skills in a particular area, Jenny, is now secured a job, at the pinnacle. I'm not suggesting that everybody who's running a project is going to get to the point where they've got that kind of impact, but just having a think about people who come to your project, organisation, service, what's happened as a result of them attending your course or your activities or your thing, and is that in line with what your theory of change sets out to achieve, or is that an additional benefit, something else you'd unforeseen? And then what are they doing differently? How are their lives changing as a result? So in Jenny's case, she's secured a job. Jenny might also have, made new friends. She might now be going out more. She might have, there's a whole range of things Jenny might have done as a result of her improved confidence, as a result of improved skills. And then in terms of value, there's different ways we think about value, because value is different for different audiences and for different reasons. So there's the direct benefit and the direct value to Jenny. There's the indirect benefit to Jenny's sort of family, to Jenny's future employer and others, as we'll see. And then there's wider benefit. So wider public sector or national institutions, are benefiting as a result of this. And you'll see what I mean. So I would just spend a second having a think. On this right-hand side, we've got these empty boxes. You can doodle out your own, or if people want to get in touch with us, we can send over the templates and worksheets on this for you to use. But what's happening as a result of particular stakeholders getting involved with your activities, services, drop-ins, whatever it might be, events, and then from what and it might be through word of mouth, it might be that you've had a chat with people afterwards, it might be that you've held focus groups or you've done some surveys. We'll come back to methods, but from thinking about an individual who's perhaps comes to mind, what changes happened for them as a result of engaging in your activities? What's going on? What's improving as a result? And what are they doing differently? And, you can have a think about who this is of value to. It's a value to that person directly. Who might indirectly benefit from what's going on? Usually it's family members, carers, your own staff and volunteers, schools, colleges, future employers, GPs, the local hospital, probation officers, who knows, depends who you're working with. And then wider benefit, who in order to understand the wider benefit, it's thinking about the bigger picture stakeholders, those sector specific agencies and organizations who ultimately their goal is, for society to improve in varying ways, that you'll fit in that puzzle. So who are those commissioners that you might not even have met yet, but you're adding value to what they're trying to achieve because you're delivering results that they need. So while you're mulling that over, I'm going to just roll on to accounting for social value a bit further. So building on that direct, indirect and wider value, whose value is this anyway? So Jenny is now, she's got self-worth, she's got more money available, and she's got this job. She can now pay off her debts and she can afford to feed a family. Indirectly, a family's benefiting from this increased health and well-being in Jenny, because she might be more positive, she might have a better mood, she might be going out more and socializing in different ways, going to places that they've not been to before. Her employer is benefiting from Jenny's skills. Jenny's developed these skills, she's got this job, and they've got new talent, so the employer's benefiting. The local Shops are benefiting because Jenny's spending more money in the local area because she's got more disposable income. And then, wider, the government. So when you think about the bigger picture stakeholders, who's benefiting from this that you may or may not have contact with, the government's benefiting from savings in welfare benefits and increased tax payments, put crudely. The school that Jenny's children go to are benefiting because the children are happier in school. Maybe their grades have gotten better as a result. Maybe the other challenges that were going on have subsided or starting to. And the local economy benefits because more money is being spent locally. There's other people this could be value to, and you'll see here. So in summary, there's direct beneficiaries from this work. There's indirect beneficiaries from what you're doing. And then there's bigger picture indirect, where there might be, people who are providing statutory support. That's now there's a cost saving. It might be reducing whatever antisocial behaviour or things affecting the criminal justice system. It could be, things to do with drug and rehab, things to do with the Home Office. It could be local councils. It could be, everything's very specific to what you're doing. But we thought at least if we give you a flavour for what kinds of things start to equate to social value, you'll start to look at how you design, deliver, and think about capturing the impact on your activities and services in new ways or in different ways. So let's take a step from a different angle and think, how do social enterprises create value? We've talked about it in a very wordy kind of way, but these are all social ventures that I've worked with over the years, many more, and how are they creating value? Lots of different ways. So this is a kind of chain, if you will. So there's some sort of organizational service delivery. There are activities that happen, whether you're an organization or not. Something's being delivered in an organized way. And then in terms of that theory of change is experienced as a result of what's being run. And then as a result of that, some sort of social impact being made. So that's the kind of chain of events up to this point. And then, the value can relate to the way the change is being made. And that change might be made in terms of health improvement, educational improvement, increasing employment chances or access or quality of skills, quality of career pathways and income options in future. It might be to do with housing improvements. It might be to do with local economy or other forms of economy. As we've said, criminal justice, environmental improvements, and other social benefits. And you'll have a think about your own context and you'll tick some of those boxes and not others, and you might think of others. But then you can consider what kind of social value is being created. There'll be financial social value that relates to cost savings to the public purse. There's kind of local value that's being created. And then there's other non-financial value. So there's, we talk about social value, we're thinking about the spectrum of value. And to help work out, next steps on from there, hopefully you're still with me, there are different social value measurement methods. And that's why we talked about the financial, the local, and other types of non-financial. So when we think about the cash value, we tend to start to think about things like social return on investment and putting a financial value and looking at what they call financial proxies. So what it physically costs to keep somebody in a hospital bed, what it physically costs to keep somebody in prison, what it physically costs to look after a young person growing up in the care system. These costs, what it costs for a GP visit, what it costs for a mental health prescription, a particular prescription or whatever it might be. There's costs to all of that can be calculated if you've got the time, the hours of the day and the budget, and that's one option. You've also got something called LM3, which is looking at how money remains in a local area. and how money gets put back into local economies rather than sort of leak money to all over other areas. And then, it's a bit like the brain drain. You can have all this talent through universities or colleges or wherever, and they seek jobs elsewhere, and you don't get the benefits locally. The same can happen. People earn their money. If you've not got the methods to keep the money, retain the money locally, it leaks out. But here, there's an interest, and particularly through projects like Proper Good, where they're looking at building, the social economy in the likes of Stockport, Oldham, Bolton, and Wigan. And any area that's got a vested interest in social enterprise is looking to not only create social outcomes and social benefit, but looking at the local landscape as well, to make sure that money and benefit remains locally where possible. And then there's the non-financial stuff tends to refer to things like health and well-being, happiness, feel-good factors. So that's, one method of measuring that is outcome stars. And there's a thing called WEMWebs. If you work and measure mental health improvement, for example, WEMWebs is a recognised method for doing that. And then there are other sector-led tools. HACT is a housing sector specific social value. They have their own social value measurement tools in that. You'll have come across, carbon footprint calculators and other environmental tools. There's different methods for measuring this stuff. And my school of thought and the colleagues and associates that I work with are that, blended methods are a good way of covering all bases. Most people haven't got the budget, the time, or the hours in the day to throw loads of money at this unless they've reached a certain size or particular commissioner or funder is requesting that they do this. And methods and approaches are changing all the time, but we would recommend using a blended approach, which I will come to show you in a minute. Keeping it simple and affordable. You can't really do anything else. You can only work with what you've got and what you know, but starting something is better than doing nothing. And over time, a simple way of getting started is working through a social impact and value measurement exercise, potentially with support or external people to help further endorse and add an element of legitimacy and robustness to what you're doing, because it's independent, and working towards working out what are your key value indicators, what are the key areas of value within your theory of change and within what your beneficiaries and stakeholders are telling you, marry up and are clearly the areas of impact and value that your organisation achieves impact and value in, so that you can consistently measure that over time to get really solid data and information, and so that you're not having this scattergun approach. What happens is people measure their impact and value based on what this funder says or what happened at that particular time or something based on this particular project or programme, and it all gets a bit messy and you can't compare apples and pears, whereas if you take a step back, you really look at what value is being created and what's happening consistently. You measure what you're doing consistently, and that's you lead your own impact measurement then, and the language that's required to communicate that, and then you can bear the bigger picture impact indicator needs in mind, things like we just spoke about. So thinking about your impact indicators, you might think, is it health? Is it education? Is it, what areas of social impact are you having an impact in? But putting it in your own terms so that your community can engage with the process and answer questions that make sense to them and you, that can be analysed and then, written up in a way that can then be communicated to different audiences. And you basically, you've got your statements of evidence, because this is what you're doing and this is what 70% said this, 100% said that, 2/3 of your, service users are now doing this as a result, 50% are now doing that, X amount of money is now being saved because whatever, 50% aren't doing this anymore. You start to then, create some pictures, some statements, some evidence, and whether you doing that from a point of view of looking back over evidence, or whether you're looking at a point of view of projecting what you intend to do, social value indicators or social value projections can be used for both. So even if you're brand new and you've not got loads of track record yet, you can still sit and think through your theory of change. You can think through the areas that you intend to have impact. You can project that you're going to work with 50 to 100 to 300 people a year, and get some likelihoods and percentages of what might happen, or if this happened, this is what we would say. You can make some projections basically, and there's evidence out there that helps back up what you're saying and shows you what other comparable organisations are doing. So you can really leverage on this, even if you're a new organisation. So what I've got here, apart from a very busy slide, it's just some examples of mapping. Who do you need to talk to, basically, if you're going to try and measure impact? Who's benefiting from what you're doing, and where is the value for these people? That's what this slide's seeking to start to work on. So we've got 4 examples. Down syndrome, a dance organisation, led by people with different learning differences and physical differences. In Place of War are an organisation who go out to different war-torn parts of the world and help local people rebuild their lives through creative arts and entrepreneurship and unlocking local talent. Shiverpool is a performing arts organisation based in Liverpool that does heritage and history and performance, kind of talks, walks, and all sorts, bringing history and heritage to life, and helping students who perhaps done dance and drama and other performing arts get access to work and exposure in alternative ways to other forms of jobs that they might get. Met Munch is a spin out of Manchester Met University, where a lecturer there, a nutrition science lecturer, wanted to bring learning to life, and as it turned out, has ended up setting up their own community interest company, both to bring learning to life, to create experiential events. Sometimes they've got food and catering as part of what they're doing, and they've actually ended up setting up a vegan cafe now as a separate social enterprise as a result. So lots of different examples there across different sort of spectrums. The legal structure is kind of irrelevant, really. Whatever your legal structure, whether you're a traditional social enterprise or a charity, or maybe you're more of a private company, this can be done, this social value measurement can be done regardless. In thinking about who's who, and this just builds on conversation that we've had across these sessions, where sometimes your customer isn't the same as your beneficiary. We touched on this on the business model canvas, just reiterating that a little bit here, where when you come to think about what you're doing and who your stakeholders are, there's customers and there's beneficiaries, and then there's kind of wider indirect beneficiaries. And mapping out who these people are helps you think about their interest, their role, their involvement, and what value you bring to them. So that's why we've got this out there. And we've been talking about income generation through the income generation session. And so this just sets out the kinds of products and services, the kind of activities and interventions that people are running in order to deliver their theory of change. Okay, so I'll just do this. I'll try and do this as quick as I can. With Dance Syndrome, their direct customers are dance trainees, so people that are coming to learn dance and take part in dance for people with varying levels of ability. Their direct customers are people buying tickets to come and see performances. Their direct customers are education and learning and health commissioners, so they've got people contracting them to do education and learning programs. They've got people contracting them to do health and wellbeing programs. And then there's also SMEs and corporates who they might be buying tickets to come to events, but because Dance Syndrome also runs inclusion workshops and runs equality and diversity training with SMEs and corporates, they're an additional direct customer. So they've evolved to have a broader range of customers than just initially the group of people that started dancing with them. There's a whole set of other customers there, and they're all part of the stakeholder group. You've got the direct beneficiaries in this case are dancers, schools and educators, trainees coming into those programs, event and conference attendees, and business employees. So somewhat similar, but possibly slightly different. But in the main, their customers and their beneficiaries are similar. And in further afield, those indirect beneficiaries are the families of people that are attending Down syndrome sessions and activities, the wider business community who are, going on programs or attending events. You've got colleges and universities, because you've got young people going through Down syndrome who've got their aspirations raised and are now going on to study things in new ways. We talked about the local economy benefiting, and so local venues and cafes will be benefiting when the performances are put on in and around Lancashire. I think there's the main areas, but I know they've done national and other performances. Event goes on, local venues and cafes will be benefiting as a result, amongst other local amenities and organisations. And obviously from the inclusion workshops, there's the colleagues going on. When those people who've been on inclusion workshops go back into the workplace, the colleagues and the customers in those businesses may well be benefiting from what those people have learned. So it just gives you a walkthrough example there. In place of war, again, direct customers are the University of Manchester, because they've got research, academics and others benefiting from being part of bids, joint bids that they work on. The Arts Council are directly benefiting as a investor in this work. An organisation called Sainsbury, as in the Shops Foundation, have commissioned work from these guys. And as far as I know, the British Council as well, in different parts of the world, are a direct customer. So quite a grants heavy set of direct customers there. It's not the direct public, as you'll see. In terms of the direct beneficiaries, so this is where your customers and beneficiaries differ. There's all these grant funders and investors that are investing in research and policy work, global creative enterprise programs and conflict resolution training. And as a result, the people benefiting are people in war-torn countries, having their hope and aspirations raised, keeping a connection with families and others that they wouldn't otherwise have. Artists and performers are, retaining their knowledge, skill, and reputation, and actually learning to become more entrepreneurial in their thinking as a result. And wider NGOs that are trying to reach these countries and places in place of war and others are getting a foot in, so that other NGOs can then come in and work with these groups as well. So that's an example. So in terms of indirect, economic development and conflict resolution departments around the UK and the world, corporate brands, a big part of what they do is using corporate sponsorship to deliver these programs and to bring different kinds of corporates into countries that they haven't worked in before. And then obviously the children and families of the artists and performers in the countries that they go and work in. So you've got a completely different scenario, but hopefully it gives you a flavour for the range of types of stakeholders that organisations can have. Running through, so Shiverpool is slightly more private sector led organisation. They started off piloting as a community project and evolved into sort of private sector organisation, but they are obviously dealing with the public, selling them tours and cultural heritage experiences. There's local businesses booking onto those and being part of some of the tours. Local universities are benefiting because they're students. You've got 2 or 3 universities in Liverpool, and then there's the kind of local public, and then there's kind of wider tourists. I've sort of split those out that are getting involved in tours, buying merchandise, and going home and telling their people have had a great time, hopefully for repeat business. The direct beneficiaries again are similar to the direct customers. Indirect, different, but again, it's those bigger pictures. It's the local tourist board and leisure industry, HE and FE institutions, because local students are being talent scouted to go and either volunteer or achieve paid work in the organisation. And obviously local families and employers who are going on tours are benefiting. And Net Munch, obviously Manchester Met Uni are benefiting from the sort of kudos and direct impact within the university. I know they're doing work with museums amongst other organisations, so they're a direct customer, Museum of Science and Industry in Manchester being one. Different food, so people are buying their food and catering services, so they're customers, direct customers. Students and staff, and other BCSC organisations, SMEs and corporates are getting involved in events, are buying goods and so on. So the direct customers there. They are similar to the direct beneficiaries, but there's a slight tweak there on other stakeholders buying in, and benefiting or experiencing the training and development, creative exhibitions, the cookbooks and other tools and resources that they share online around food and recipes and being more nutritious and being more plant-based in your eating habits, and purchasing catering and merchandise. So these are the sorts of things that the beneficiaries and customers are benefiting from. Indirectly, again, similar set of folks. So I tell you all of that just to give you some different scenarios of the way social enterprises operate. You'll have your own thinking. You may or may not have a legal structure, and as I said, that's by the by when it comes to mapping this stuff. You'll have direct customers that you could think they are handing over cash, they are paying invoices, they are doing back transfers, they are offering up grant agreements, they are setting up service level agreements with us. Put them down. They're your direct customers. They're buying X, Y, and Z. What are they buying? What products and services are they buying? And who's benefiting as a result? What often happens in social enterprises is you start with your beneficiaries, you design your products and services off of that. If your direct beneficiaries are paying for your stuff, brilliant. If they're not, you have to take a bigger step back to think who's going to pay for this stuff, and you work that out accordingly. But at least this gives you a sense of how different social ventures are working in different contexts, and helps remind you of just the much bigger beneficiary pool you've got. So just like in these cases, you'll have examples of people that you may never meet. You may never meet the families of people that you're working with. You may never meet local economic development departments or the local tourist board or your local health and social care team or whatever it might be, but they're benefiting from what you're doing, and thinking about ways to move closer to some of those indirect beneficiaries, because they might be future commissioners of work, is something to think about. So these are the kinds of people that we need to involve in our social value measurement work, and that's why I put that down there. So even if you've never met yet the families of people or certain organisations or certain potential partners and stakeholders, there's no harm in talking to them about, are they aware of your work? How are they benefiting from what you're doing? What have they observed? How do you compare with other organisations? So that's why we sow this seed with you, to just think about the bigger picture before you start to think about how might you go about this. So in terms of how you might go about this, who do you engage with to measure this stuff? We would suggest it's a combination of direct, indirect, and wider stakeholders. You really do have to consider, your capacity to do this, your time, your budget. What do you want to throw at this stuff? It might be that right now you've just got to work with your own beneficiaries, ask them a few key questions, and evaluate where you're at and what you're up to in line with certain funding requirements. And that's fine. That's where most people start. But as you roll on, in order to demonstrate more depth of value, in order to show that you're evidence-basing your work and the impact and value that you're creating, and put some stronger information into funding bids, pitches to commissioners and anyone else, you might need to look at doing this in a more robust way, particularly as you grow, and building in budgets to help you to do that. So sometimes at a later point, you might want external support, either to train you in how to do this well from the start. Hopefully this webinar's got you on a little bit of a journey. If you need additional support from us or anyone else, or as you grow, you might want that external support for legitimacy, independent views and robustness on what you're saying. That's things to factor in. considering the ratios of who to involve is quite important. So not just, as I put it, not just going for the easy pickings and the champions and the people who would say something nice. Oh, I mean, you do want to cherry pick and identify some of those people who've gone on the longest journey or the most in-depth journey with you, to ask them about their experience and their feedback and what they value. But we'd always say, alongside thinking about the impact and the depth of impact you've had, tallying this up to get more benefit from this than just social value learning, you can create some market intelligence gathering alongside this. So the way you would do that is, don't just go for the low-hanging fruit, go for those stakeholders who you have less contact with, go for the find out from the families and other members where you've got ability to do that. Talk to people who've perhaps didn't continue with you or had to leave, or didn't work out, where you've got the relationship to be able to do that. Getting their feedback from people where this didn't work for them might help you strengthen your service in future, alongside measuring other forms of impact and value. The other thing this is good for as well is if you're trying to build relationships or repeat business, or you want to maintain strategic relationships with all sorts of future partners, current partners, investors, and whatever, they're your stakeholders as well. And so you have a bit of a 360 review where you involve, as I say, direct, indirect, and wider stakeholders, and you pick a few of each. So typically you might do 8 to 12 interviews as an example, or somebody externally might, or you might invite people to a focus group, partly to showcase and champion what you're doing, partly to gather feedback. There's lots of ways of doing this, and getting their input, and that input from a range of people helps you maintain and promote and gather evidence and build your reputation with lots of different characters. So there's 2 or 3 benefits from doing this when you plan it in a certain way. So take it back to Down syndrome, one of those examples. If we just quickly walk through how they might go about doing this as a bit of an example. This is my guess. This isn't specifically and exactly what they do. If you went and rang Jen, who's the woman that runs this, and says, is this correct? This is me guesstimating what they would do based on thinking about how they operate. So we're going to think about, who they're talking to and how. So with their direct beneficiaries, if we remember, that's their dance membership and course participants, performance attendees, those business and community workshop attendees, and not forgetting staff, volunteers, and board in the mixture of direct beneficiaries. There's different ways that you might approach them to get them to talk to you or to give you feedback and information. So there might be some one-to-one notes and reports. So there might be an application process in applying. You design your application process in a way that captures some of this stuff up front, that you can then go back and ask for feedback and surveys on later. Where people are doing work on a one-to-one basis, and you've got case notes or one-to-one notes or whatever, there might be questions or points where feedback's gathered then. For ease, when not everybody wants to fill in surveys or write stuff down or whatever, there might be events or opportunities where there's, video capture. There might be little vox pops that get recorded from time to time as part of wider promotional stuff, but you're also asking some feedback at the same time, so that that can be looked at and included as part of impact measurement work. Focus groups I mentioned, or other events with creative feedback questions. So there's lots of ways that you can go about talking to your direct beneficiaries, the people that you see and are around most of the time, to get them to respond to questions. Likewise, we'll come back to those questions in a second. The indirect, so that's those that probably you've got less contact with, but they're at your disposal. So families, carers, employees, managers, schools, future employers, where they can go and have a look at that, or they can hear from the direct beneficiaries who's been benefiting or where they've gone on to, and then follow up with that line of thought or that line of change along that, change journey that they've been on. Then more likely, it might be interviews, telephone interviews, there might be surveys. You might invite them into some sort of event or showcasing thing, or create a little focus group so that they can network and get something out of whatever you're putting on, and you can ask them a bunch of questions. And other forms of evaluations, there might already be evaluations out in the wider world that you can read and think, well, they've done this evaluation on such and such. What role have we played in that? So it's just having a think about what's other ways to get hold of these people, and think about how they tell you, or they'd show you, the value that you're bringing to their lives, their work, their strategies, and so on. So it is very simple in both cases, and we'll come back to wider, but wider's very light, indirect, interviews, focus groups, other market intelligence, reports that are out there. The questions that you're asking ultimately is, what have you been getting involved with? How did you come to hear about this? Warm them up to finding out how they got involved, asking them to describe, what has been of most value to you, and what have you enjoyed most about being involved with, in this case, Down syndrome. You listen in to some of what they're saying and build on that and probe where necessary to just find out a little bit more. And then, building on that to think, well, what are you now doing differently as a result? Is there anything you're doing differently? And you, dependent case to case, is there anything you're doing differently in your personal life? Is there anything you're doing differently to do with your health? Is there anything you're doing differently in our local area? You have to sometimes prompt people to think about this. You'll know from your own context, but when you think back at those different areas, is there anything that they're doing differently, in terms of their health and well-being, to do with their housing, to do with the way that they view people, has their own sort of perception or behaviour changed, the way they make decisions changed? It could be absolutely anything in line with what's most appropriate for what you're doing. And what's this led to? How have things changed or improved as a result? Of being involved, of doing things differently. How is anything happening in their life now that's improved or evolved as a result? And you can't always attribute everything that's evolved or changed as a result to one intervention, but just trying to get a feel for that and see what the beneficiaries are aware of, to be able to look at how you're having an involvement there. And likewise, it's very similarly with the wider stakeholders. What do you value about what this organisation does? How have you become aware of them? What do you value about what they do? What are the main positive impacts you've observed? That might be in relation to, services that they've seen, news reports they've read, staff or colleagues that they know have been involved. Depends how detached or otherwise they are from this organisation, and if they aren't aware, filling them in on some of this stuff and thinking about, how does their impact compare with others that they might be aware of, commissioning, linked to. So this is the point. It's sort of helping to build a strategy really for enabling those wider indirect beneficiaries to really start to become more aware and to endorse and back what you're doing. So hopefully that gives you some food for thought for your own organisation in thinking, where could we start? You don't have to do it all, even if you just started with your direct beneficiaries and built up from there. It's, creating a conversation at the end of a session, calling it a focus group or otherwise, doing some surveys, having people fill out questions at a beginning, middle and end. So you've got some benchmarking sort of journey to see what's improvements being made. There's lots of things that you can factor in to your processes that are not going to take up lots of time and not going to be that far from what perhaps you're already doing, that makes this possible. And certainly, looking at who you're working with, how they're benefiting, and the different demographics that you're working with will help you when you're trying to strengthen bids for why you should be awarded that particular grant, or how you're having impact over and above others to be able to secure new work for what it is you're doing, is really what a lot of this is about. So on the homeward stretch, just giving you a reminder and a feel for what it looks like, when it's done well, and ultimately, knowing your audience, which is why we just walked through those case studies to help you think about your own, and thinking about who you might need to communicate this with later on, thinking about what budget you've got for this stuff and what techniques might work in terms of your knowledge and skills, or in terms of your community and what they will and won't be part of. start with some thorough stakeholder engagement mapping. Who are your stakeholders, your direct, your indirect, and your wider stakeholders? Learn about what they value and focus on measuring what they value. People can throw out all sorts of questions and what they think might be useful, but really it's measuring what people value is the key, and that then helps you see the patterns and the consistency to create your own key value indicators that you can consistently say, this is what we're about, here's the key value that we're bringing, and here's the evidence that we're doing that. And then additionally, we're doing, project-based or program-based. There'll be slightly new things that come on over the years as things evolve, but you'll always have your core sort of baseline. Techniques. So we've talked about lots of different techniques there: interviews, surveys, focus groups, reviewing existing research. We talked about this in the PESL reports back when I did webinar 1 around business planning. Looking at existing research that others have done locally, nationally, sectorally will save you time, even if you've not done much yet, or even if you haven't got time to do any of this. Looking at what the other people's evidence says is an indication for what could be transferable for your organisation or in your area. I put evaluation forms there. People have these evaluation forms that they give out at the end of a program, a course. So, get somebody to help you review those questions, because often they're well off the mark. And it's all, if you look at your questions, are they telling you anything? Is there any questions in there? And what are you now doing differently as a result? Most of it's about who are you, and did you turn up, and did you enjoy it, and was the catering okay, and that kind of thing. But really starting to look, on a sliding scale of 1 to 5, how did you find X, Y, and Z? Or how did you feel at the start of the session? How did you feel at the end? Or looking at which of these are true statements for you, and tick if I've now got improved confidence or improved skills in this, or I'm now I've got improved mental health. Whatever improvements are that you're seeking to create, get them down and get them on your evaluation form, so that you've got some evidence to whether it's true or not, as to whether or not people have improved in those areas following your support or programs or events. Outcome stars, I just re-mentioned. If you're working in health and well-being, particularly mental health, outcome stars are the WEMWebs stuff is one to look out for, and Google that. And looking at using video and media as ways to capture what people say, so they're not having to write or click survey monkeys or whatever else it is that you might be a barrier for people. Moving along, the first 2 boxes are ways in which you can just get cracking. The last 2 boxes might need a little bit more help depending on where you're at in your journey. So analysis and communication. And you can have all sorts of funny bits of information talked about, and you may have then started to build on that and improve on it, but having somebody help you analyze this stuff and learn how to communicate it well could be somewhere that you want to think about in future. Helping create particular statistics, as I was saying, looking at those sliding scales and benchmarks, and analysing what's come out to help you create some quotes, testimonials, or data, and summarising existing stuff, or helping build on whatever new work and new gaps you might be wanting to fill. You might have created little case studies and testimonials and whatnot, but often they're pretty flimsy or vague. They look lovely, there's a nice picture and such a body said such a thing, and that's fine. But impact case studies and impact measurement case studies usually have a little bit more depth and tell a little bit more of the story of where someone's come from, what happened as a result of them getting involved with you, how their lives now changed as a result, and other feedback, and hopes for the future, and things that might guide others. Just thinking about how you structure your case study so you get the most out of it, both in terms of impact data, but for promotion as well, is really key. Just thinking about what you need, whether or not you should create budget for this stuff in future, and how you might link what you're doing to wider policy priorities, particularly when you're going for larger amounts of money through grants, commissions, or otherwise, is going to be important. And then last but not least, a suggestion on where you might want to bring consultancy and other support in. is on some of these areas. You know, if people need training in how to do this well or better, how to get started. You know, stakeholder engagement and facilitating groups and events to gather this stuff is an art in itself. And if you don't feel comfortable with that, or it's not your skill set, bringing people in to help you do that, you know, can be worth its weight in gold and saves you the time of having to do it. They'll come in and do it, obviously, for a fee. Producing reports, you know, and, you know, working with people who know how to work out the, you know, do the cost analysis, and we'll create some statements, key value indicators, or put value on the work that you're doing is something that may come a need for you in time. And as I said before, bringing in people independently can often make things a bit more legitimate because there's that robustness of them being independent. But ultimately, there's nothing stopping you doing this, getting started, or strengthening what you're doing, just as you are. So I hope this has been helpful. Feel free to get in contact if you need further support. As with the various other webinars that we've had, you can either contact us with details on that former slide, or contact Sector 3 directly, where they have got other people in-house to help with different aspects of running your social venture, and you know, a great team there to offer some support on this topic and many others. So thanks so much for listening, and good luck with measuring that impact and communicating it well. Thanks for listening.